there are a lot of issues in healthcare. We have demographic changes, we have technological changes, the digitalization, which will hugely affect the health system. We have migration, we have probably different social groups in the future. Families are not present anymore as they used to be in the past, or we have patchwork families. So all of these things the health system has to deal with. But then we also have to look at the economic side, and the health system is very attractive because it's not actually a functioning market. And it's not a functioning market because people, they do not pay directly for the services they get, because that's usually paid by the government directly, as in the UK mostly, or Switzerland, Germany, there it's paid by insurance company. So then of course you don't care that much about how much services you consume if you don't pay for it. And the second important aspect is the information asymmetry. So the providers of services of treatment, but also the producers of drugs or so, they know much more about their product than the patients. So that means actually you can influence the demand very much by the way you present your service. So if the doctor says this is really an important thing, you should do that because otherwise there is a danger that you will die within the next years, then of course you say yes, then I will do it. But if we will present it in a different way, saying there's a high risk associated with that treatment, I would be rather careful to choose it, then you say, okay, no, then I will not do it. So you see, the demand depends a lot how you present it to people. And of course, there's a very strong incentive in the system as we have it today to do as much treatment as possible, because each player in this system tries to maximize its own income. So hospitals only think about the financial result of the hospital. A doctor thinks about his own financial results. Then the pharmaceutical companies, they think about selling their products. So there is no thinking about improving the whole system or taking care actually of the needs of the patient, because everyone has an incentive to maximize his or its own profits. And therefore, I think the big challenge is how can we actually integrate all these things again? How can we create an integrated system where we think again about the whole health system and not only about single players who try to maximize their own income, many times at the cost of others.